Thank you, Mr. Chip, for giving us opportunity at Vital Energy Wellness and Rehab Center. And I'm Hima Dalal, to occupational therapist and energy medicine practitioner, to work with your injury and post-rehab. If you don't mind sharing that what had happened to you and how all this started.
On March 15th, I was in an automobile accident and had a fracture of the tibial plateau and my shin bone down here. And I've had plates and screws in both of them, and I have had some nerve damage. Started out seeing a therapist, and I was seeing two therapists, and Dr. Jeff Guy, the team physician in South Carolina, suggested I see Hima. The other two people were doing primarily muscle things with weights, and that was about it. Some treadmill work, but when I came to see Hima, she started working on the nerves, which was the big thing. And since then, I think I showed up here probably mid-May in a walker and couldn't even put any pressure on the leg, and now I'm walking pretty naturally. Still got work to do on the nerve stuff, but she's worked on me every day. She hadn't passed me off to somebody else, and is generally concerned with my well-being. She's been able to watch me walk and tell what muscles that I needed to concentrate on with the other therapists, something that none of them even did, watch me walk or concentrated on what areas needed improvement. So I think it's just been completely 180 degrees different than what I'm doing with the other two people.
So the complications here that you ran into post-injury was the surgery was done, but somehow the nerve was compressed and you had a paralysis of the foot, and also some of the muscles in the hip and knee were paralyzed. And he walked with the foot drop, and you had an AFO that you were wearing, you had a walker, and somehow the nerve was not regenerating. And usually the nerve takes a while to regenerate, but we were able to take care of the paralysis using alternative therapies that we use here, using crystal myofascial release treatment technique, and using the lot of different energy medicine practice that I do helped recruit the nerve much faster, and was able to do then specific muscle strengthening to avoid the fatigue and to avoid the delayed rebounding in the muscle. And I think the pain was much more tolerable with this treatment too, right?
The pain was an aspect of it, but as I say, that wasn't the primary thing. Was nobody else was working on the nerve at all. They were all working on the muscle. And without the old nerve work, I don't think I would have come nearly as far as I've come. And none of the rest of me, offered any of the treatments that you did.
And then you had a post-back surgery in past too, which had caused the other three toes.
Correct. Other four toes on the right foot.
Other 4 toes were also curled up, and that is getting better too now.
That's much better. They are straight now, and I can put weight on my toes, and there's no question in my mind that it'll fully regenerate.
And Dr. Guy wanted me to work on a little bit of the post-concussion treatment too, and make sure that you had some numbness in your forehead and a little bit on the face, and then the scar was really adhering. So we worked on the scar, and we worked on bringing some numbness down too on that area using the scar myofascial release treatment.
That's correct, and the scar was terrible, and it started to chelate and was really up in my hairline, and it was not good. Now people that see me said, well, I thought you had a scar up there, and I can barely, it's barely noticeable. As long as I don't lose my hair, I think I'll be fine. But that's an outward sign of what I think she's done on the inward, the things you can't see is what's happened with this scar, and of course the headaches and all that I had with that. So there's no question in my mind this is would be beneficial to anybody, and Hima again has spent a tremendous amount of time with me personally that I haven't gotten from the other therapists that who have turned me off on to somebody else or the newest employee and just give me a regimen of exercises to do. So I've been very pleased with the treatment. If I had to give one up, I've given one up, and this I would not give this one up.
Thank you so much, and it has been a pleasure working with you.
Well, thank you so much.
Thank you.